Hello, my friends. Welcome back. Last video spoke about how I handle my CAR T infusion transplant. And I went over about fevers, that I did get fevers, but I didn't really elaborate as much and explain the fevers better for you guys to understand. Because fevers is very common of CAR T cell transplants. And they could occur pretty much any time, from 4 hours after your first infusion day to 72 hours or longer sometimes. And what's happening is the CAR Ts start binding with the cancer cells, and there is a release what they call CRS, Cytokine Release Syndrome, in which causes many different other side effects besides just fever. But the fever is very common part of CAR T cell. You will more than likely have a fever, 100 and above. And how they treat it and handle it is totally different, because we all have different effects of the fever. I mean, I did get diarrhea from the fever, in which is also another side effect of the CAR T infusion. One thing I also got was the loss of appetite, in which I did lose 28 to 30 pounds at that time, in a matter of a few weeks, basically. And not only that made me weaker, that losing that much weight that quickly, it is something that you are not eating, you don't have the fuel, you feel weaker. And I was weak. And after a few days, I was using a walker because I did not feel safe walking, going to the bathroom, going anywhere, even walking outside. I wanted to use my rolling walker because my endurance was low, my balance was off. I just did not feel myself after the fevers hit. So that I knew that the CAR T was actually working and killing the cancer, but it really knocked me out. It gave me a good beating for a little bit. I really felt it. Before I got discharged from the hospital, I was still using a walker, and they sent me with a walker home. But once I was home, I was able to manage myself without a walker. Another side effect that I did get from the CAR T transplant was my hands were trembling. I felt like I had Parkinson's. I had the shakes. My hands were constantly shaking. That actually went away on its own. But I did notice when the doctor will come in or the nurse will come in and ask me the questions that they always ask you, to make sure your mental status is clear and you're not having some other reaction. Because with the CAR T, it does affect your mental status. And you do forget things, or you say things that don't make sense, or you're trying to speak and you can't. It's just the words don't come out. But that's part of the CAR T transplant. And I saw my handwriting become less than perfect as I was writing my sentences every morning. And my hand shaking, and the lack of endurance and the lack of eating, it all was taking a toll on me. And I felt it. I have to really admit that I felt not myself after the CAR T cell transplant. It was much more in that. But the first few days, the physical therapist will come by and take me for a walk. And I'll be out there with a walker. And I could only do when I was actually walking a mile, doing the whole laps in that hallway. I was barely making a quarter of the hallway. It was just going from my room to the window, hanging there a few minutes, catching my breath and walking back. And I knew this is part of the CAR T, because the CAR T does lower your endurance. It's part of it. Sleep. I was able to sleep correctly even with the fevers and even having ice on me. But I would dream that I was ahead, living ahead. So the most weird thing, I will feel that I had lived the day already, even when the day had not even started yet. I will wake up thinking, I know what's going to happen today. It was one of the most weird reactions to any treatment I ever had. And it's something that I freaked out, because I would tell my wife, you know what? I lived today already. She'd be like, what do you mean? I know exactly what was going to happen today. And it was crazy to think about that. There was other moments that the nurse said that my mental status wasn't clear. That I was saying cream of wheat for everything. She asked me a question and I will answer her with cream of wheat, cream of wheat. I don't remember, I don't recall, I don't know, but I have to go with what she said. They did give me steroids that day to calm the CRS. Because basically that's what's all coming from the attack of the CAR Ts going after the cancer cells. But after 3 days, the fever subsided for me. And things just started shaping differently. I started feeling better after that 5 or 6 days of weakness, of instability, hand shaking, fever, diarrhea. But it just started subsidizing little by little. My blood counts were normal. Well, not exactly normal, but a little low. But doctors were happy with them. So this is how I progressed in the hospital. Then I started eating little by little, but my stomach still bothered me. And it was not nauseous or I wanted to throw up. It was just my stomach was turning. And anything I ate just would turn, and I have this nasty flavor in my mouth. And not metal, because I know I had metal taste before from chemo, but this is not a metal taste. This is just a bad feeling. I mean, I even smelled it. That's the craziest thing. But again, as the time went on, little by little, I was able to come home. They kept me an extra day just for safety, because they didn't see me. They didn't think I was good enough to go home yet. But then the next day, they said that I was writing my sentences, counting backwards, no problem. I knew I was in the hospital. My mental status was much clearer, and they sent me home. And I've been home for over a month already. And the process, like I said, I will continue giving it in another video, how I handle transitioning from the hospital to my house, because I like to keep my videos short. And my friends, if you like this content, please hit the like button and subscribe. Share with people that may need to hear about CAR T-cell transplant or cancer in general. Because not just because I have non-Hodgkin lymphoma, it doesn't mean that it's a different type of cancer. Yes, it is a different type of cancer if someone has breast cancer or prostate cancer. But cancer is cancer, and how we handle and deal with it is pretty much the same. We're all cancer survivors. We're all warriors. So don't ever forget that you're stronger than what you think. And remember that. Always keep that in your mind. So please hit the subscribe, visit my website. Any questions, just write. Any comments, just write it there. Down at the bottom in the comment section, hit the subscribe button, and I will see you on my next video. Thank you, my friends.